the next thing I wanted to talk to you about was this kind of glamorizing of the Blair and Brown government and the NHS. We've got here a tweet from Ben Bradshaw correcting Diane Abbott, who says, Diane Abbott says, Keir Starmer has joined the right in calling for the reform of the NHS, and we all know what that means. Ben Bradshaw says, no, he's leading the calls, Diane, just as the UK Labour government did between 1997 and 2010, reformed the NHS and delivered the shortest waiting times and highest patient and staff satisfaction in the NHS's history. Now, is that a myth that everything was rosy in that Labour government between 97 and 2010? I mean, you spoke before about PFI and the cost of it. Was it good, and just that PFI is a bit negative, or how damaging was that government for the NHS?
Yeah, so compared to historical average, the Blair-Brown years saw a greater investment in the NHS. So you did have a reduction in waiting lists, but what they also managed to do was breach the founding principles of the NHS. So they were the first to outsource clinical care. And what that meant was the easy, simple, profitable cases were now being done for profit by the private sector, being paid more than the NHS was being paid, and having a destabilizing effect on the NHS. Under the cover of private finance initiative, which we borrowed 11 billion and we're going to pay back 80 billion, the servicing of that debt is taking away, I believe the figure is 2 billion a year away from the delivery of care. Now that could buy a lot of operations and pay for decent staff wages. So they set in train a breach of the principles of the NHS, a system of money bypassing patient care altogether. And let's not forget the PFI fiasco, deliberate financial scam, was cover for massive bed capacity reduction. They cut thousands of beds to build these PFI hospitals. And the main problem we're seeing playing out in the NHS now is, guess what? A lack of beds and not enough staff. And Keir Starmer and Wes Streeting are not addressing those fundamental issues because they're harping on about reform. But what they actually mean, there are no legal changes that need to be made to get us to the American system. What they want to do is break the morale of the workforce. That's why they're attacking the staff. That's why they're not supporting strike action or a pay rise. And that's why they're undermining general practice, because they want the model to shift more towards the American system, whereby, in fact, you no longer have a GP that you know over a period of time. You have a salaried workforce where you never get to know the same doctor. You never see the same doctor twice. You have more and more non-doctor professionals like physiotherapists and nurse practitioners and all the rest. This is part of a downskilling agenda. And you lose the continuity of care, which we know saves lives. You lose the job satisfaction amongst the professionals, and you dump greater clinical risk burden on less trained people, which is an inherently less safe health service.